So SWOG 1318 study was led by Anjali Advani for our group. And as you know, the outcomes of patients who are older with B-cell ALL is not as good as the younger patients. And specifically, that was true in the BCR-ABL mutated ALL population. About 1/3 to as many as 1/2 of older patients with B-cell ALL will have a BCR-ABL fusion. Now, with the advent and the use of the ABL tyrosine kinase inhibitors, the outcomes of these patients has improved. But still, older patients don't tolerate chemotherapy very well. We now have several independent data sets that really support the use of an ABL tyrosine kinase inhibitor with a bispecific T-cell engager against CD19, and that is Blinatumomab. SWOG 1319 was such a study in older patients with BCR-ABL positive B-cell ALL, where patients received an induction phase of Dasatinib and steroids, and then were given Blinatumomab afterwards. I think the remarkable thing about that intervention that I always like to stress is that when you start with just the ABL kinase inhibitor and not adding chemotherapy, you don't have to worry as much about the added myelosuppression from the chemotherapy. Likewise, if you cytoreduce the disease with the Dasatinib and the steroids, and then come in with your bispecific T-cell engager, we find that these patients tolerate that much better with lower incidence of cytokine release syndrome and encephalopathy, and definitely the severity of those two is lower. And why is that? Because the hematologic remission rate is 100% with Dasatinib alone or Dasatinib with steroids. So it's a really nice way of getting these patients into a remission and then giving them follow-up therapy with an immunotherapy that has clearly led to more favorable long-term outcomes for these patients. They do go on to continue the ABL kinase inhibitor with vincristine and with steroids as a maintenance, but the outcomes we're seeing now with this combination are quite encouraging. And of course, the Jemima group and Professor Foa have published their results with Dasatinib and Blinatumomab in a larger data set that recapitulates what we said in this, and found in the SWOG study. And of course, the excellent work from MD Anderson with combinations of ABL kinase inhibitors with Blinatumomab, showing very high response rates and very encouraging long-term survival, not only in older, but in younger patients as well.